Welcome to another session of Lasing is Amazing with Dr. Glenn Van Ass. Today is a case where we're doing a single crown on the upper right central, number 8, or tooth 1-1. We need to do some gingival recontouring on this tooth. You can see here in the video when you look that the left central is about 10.5 millimeters, but the right central is shorter. It's about a millimeter shorter at 9.5. So we'd like to take about a millimeter of tissue, ideally, with the diode. It's a large composite crown that's on this tooth, and as was necessary to do some erbium YAG crown lengthening on the lingual portion, but the diode was used in the buccal to remove a millimeter. You can see we're probing here, and that the probing depths are about 3 millimeters and sounding down to bone, so we have room to take some gingival tissue, and we'd like to even it out. You can see it here at high mag. The diode laser is used initially at 1.4 watts. We noticed when we look at high mag, there's a little bit of charring that happens right here. I stopped and lowered it down to 1.1 or 1.2 watts pulsed, and you can see it starts to drag. It's dragging and not really cutting very well. So at this point I stopped again and put it into an intermediate position, which is 1.3 watts, and this was pulsed. And I used that for the entirety of the procedure, which just took a minute or so to remove about a millimeter of tissue. All we're trying to do is make the two centrals even. Now, as you get some coagulation on the tip, what you need to do is remove it with a wet gauze. You can see I've got an initiated tip because the tip is in contact, and we're gradually in short brush-like strokes removing really the superficial 1 millimeter of tissue so that the two centrals will be even. You can see some white and necrotic slough sometimes on the distal of the tooth, and that can be removed either with the diode or with hydrogen peroxide afterwards. We're gently removing, and often what I'll do is switch between low and high mag, because what happens is you become so focused you lose track as to whether you've actually removed too much the same. So I'm moving back to low mag here and reevaluating the shape, the gingival zenith, to make sure that not only is it round and symmetrical compared to the adjacent tooth, but that we're happy with the overall appearance before we remove the large composite crown that's there. At this point we're measuring it's 10.5 on tooth 8 and 10.5 on tooth 9, which is a veneer, porcelain veneer. We're going to replace the composite crown that's on this tooth. Here's the immediate post-operative appearance, and you can see a nice result. When we remove the composite crown, you can see two large pins, and I had to make a decision. We're going to try and block this out with a white color. In the back you can see a post and core and very deep subgingivally. We blocked it out with a tinting color white to make it even, and you can see the lingual aspect. We use erbium to do some crown lengthening. Tooth is ready here for impressions. We use some Expasil pushed down to laterally distend the tissue, and there is the impression immediately thereafter. We made a provisional for the patient. Patient was sent home and 2 weeks later returned, and here's immediate view with the provisional, and we remove it. You can see there's some bacteria staining there that was removed with hydrogen peroxide. See the black bacteria stain and removed with hydrogen peroxide and ultra dense syringe brush. There it's clean now, and at high mag you'll be able to see the nice tissue response that we're getting on the labial. Here's the lingual with some topical to try and push the tissue back. That's the pink color, and here's the palatal view of the beautiful tissue health on the palatal aspect after osseous closed flap crown lengthening. Here's the crown in place. You can see a beautiful tissue response. This is immediately on the day of insertion. You can see how nice the tissue has responded and how nice the gingival zeniths are, and it's fairly symmetrical. Really a nice result when you look here. So I hope this has showed you how gingivectomies can be combined with crowns. This is Dr. Glenn Van Ass saying goodbye. Lasing is amazing.